results of their patients.
The Toronto Ketamine Clinic, an idea that started in 2016 after its founder, Justin Davies, says he finally found help for his 20-year struggle with depression.
For me, it was life-changing.
Working with doctors and psychiatrists, the clinic takes up to a dozen new patients each month. People who've tried at least 2 traditional depression treatments without success.
Oftentimes when I see people in the clinic, they've had much more than 2 treatments. Often I'm seeing individuals who have had quite lengthy struggles with depression and failed to respond to treatments.
Ketamine was originally created as an anesthetic. It's a powerful sedative that needs supervision.
If you were to be using ketamine in an unsafe environment, you may become too sedated to rescue yourself.
But when used carefully, this clinic says they've seen a 70% response rate. 20 years ago, this man escaped a house fire, leaving him with PTSD. 5 months ago, he started ketamine treatments.
Trippy would be one way to put it.
He felt out of his body, reliving past experiences. But afterward, he was energized.
Going into it, I was nervous, but I was at such a state in my own feelings that I was willing to try anything. So I'm glad that I did.
More research is needed to understand exactly how ketamine treats depression and how long its effects can last. The Toronto Ketamine Clinic will only administer it in the clinic and not to someone with a history of addiction like Matthew Perry's.
I think it's sad that he was taken ketamine outside of that setting and ultimately led to his death.
All right, Dr. Abraham Snaiderman, psychiatrist and professor at the University of Toronto. I understand you've seen the effects of ketamine on patients with severe depression over the years. What do you make of it as a treatment?
Thank you for having me. As a treatment, it's quite an innovative intervention. We have been looking for new ways of treating depression, especially depression that does not respond to the usual treatments. And it is a very encouraging situation to have a medication that can potentially act very quickly, very effectively, and relieve the feelings of depression, and even more importantly, the feelings of suicidality. There's some effect on anxiety, but again, one has to be cautious. And the typical 5 W's apply: who, what, how, where, and when. When do we give this medication? Who is the right person to give the medication? What's the efficacious dose? What's the safe dose? What's the safety profile, both in the short term and in the long term? And one has to be mindful that this is not the ketamine that is available out in the street. This is a different type of ketamine given at a controlled environment with somebody trained in doing it and very closely monitored to prevent side effects and to deal with the side effects, which can happen and can be severe.
Tim Caulfield is a public health policy expert. Tim, there have been some studies that have been done. We've seen some promising early results. Ketamine is being talked about in a lot of different circles, but where is it in terms of the results from those studies and the risks?
Well, look, there's a lot of promise here. You know, there have been studies that have been done, and I think most of them, not all of them, are pointing in the direction of efficacy. And the problem, though, is that pop culture has also created a lot of expectation, a public expectation that maybe doesn't fit the actual state of the science. So we're seeing a lot of hype on social media. We're seeing it in the popular press. We're hearing endorsement from, celebrities like Elon Musk, Sharon Osbourne, even Prince Harry, and that is creating a demand. And I understand there are patients out there that are desperate, but unfortunately, the demand and really that public expectation of where the science is doesn't really fit with the actual state of the science. And I think that creates a regulatory challenge, and unfortunately it creates a challenge where patients can be exploited.
We are seeing clinics across Canada. What do we know about the regulations? What should people be thinking about in terms of ketamine in those settings?
Well, look, ketamine is still a controlled drug, obviously. And there has been some interesting research that tells us that the marketing from private clinics is often less than ideal. There was an interesting study published in JAMA very recently, actually, that looked at this in the context of the United States, but I still think that lessons can be drawn for really the world. And what that study found was often the marketing, again, sort of overplays where the science is, overplays the potential benefits, and downplays the risks and limitations. So I think the watchword here is caution. Look, a lot of promise here, but how it's being represented in the public sphere, again, less than ideal.
Dr. Snaiderman, obviously we know Matthew Perry was able to access ketamine outside a clinic setting. Let's take a quick listen to a comment from the US DEA.
He followed the arc that we have tragically seen with many others, whose substance use disorder begins in a doctor's office and ends in the street.
Doctor, are you concerned that giving ketamine in a therapeutic setting risks creating addiction outside of a controlled environment here in Canada?
If we go back to the beginning of the 20th century, cocaine was used for a number of conditions to treat certain conditions, even was prescribed and given freely. And that led later on to widespread use in inappropriate fashions. We should not repeat the same challenges that they had 100 years ago with ketamine or LSD or psilocybin or other psychedelics that can be beneficial but need to be studied carefully. Yes, there is a risk. There's a risk of dependence. We don't know for how long the beneficial effects of ketamine last. The largest study that I reviewed was 90 days follow-up. We know that the effect might be wearing off within 28 days. We don't know who needs to get the medication, for how long, how many times, and at what dose does the medication lose efficacy. So I don't think it's yet ready for prime time. That's what the science says, and I agree wholeheartedly with Tim. This is not yet the time to get very excited about ketamine outside of the scientific world and outside of controlled environments.
Dr. Snaiderman, Tim Caulfield, thank you for your insights. Really appreciate it.
My pleasure.
Thank you.